And you're watching Hello on 2. Good afternoon to you. And of course, for all of our Muslim brothers and sisters who are fasting right now, selamat berpuasa.
That's right. Selamat berpuasa for now. And of course, selamat berbuka much later in the evening with your family and friends. The dessert that we showed you earlier on is a very simple one you can actually try sometime tonight or maybe for tomorrow once you freeze the fruits. Now, speaking of desserts and actually talking about food, we're going to go into a medical topic right now. But before that, we do have the quiz question coming your way. One little reminder, please remember the answers are to be given on our Facebook, not via the phone calls into the studio. So we'll take your answers or your responses on the Facebook, and then we will get back to you to let you know who the winner is.
Exactly. All right. And it's Doc on call every Wednesdays, and this time around we have, our doctor who will be speaking on this really interesting subject. All right. Now would be the hang on. Just before we
are going to go for the question first, yes?
Okay.
Yes,
yeah.
Our producer said we'll do the questions first before we talk to the doctor. Right, now let's get the question up on screen for you, and here we go. Getting it to you. All right, let's see if I can get you the questions. What is the secret ingredients in chef's cooking today? Ooh. And what is the name of the dish?
Yep.
So you've got two questions coming your way. What is the secret ingredients in the chef's cooking today, and what is the name of the dish? Please, we will put this question up on our Facebook, and please answer via the Facebook with your answers. If you caught the chef earlier, you would know exactly what the secret ingredients is. And if you know what the dish is named, then give us the answer on Facebook.
Yep, answer it correctly and you'll stand a chance to win an oven as well as a mixer. Okay?
That's right.
It would be perfect in your kitchen, no joke. All right?
All right, so there you go. Now, what we're going to do is this. We're going to talk to our doctor about gynecological cancers, detection and treatment. Now, there are various types of gynecological cancer. For women, there are actually 4 to 5 types, but we'll just narrow it down to maybe 1 or 2, one of which is, of course, cervical cancer. You have vaginal, you've got vulva, you've got ovarian. So we'll talk to the doctor a little bit about, touching on all of it. We've got with us Datuk Dr. Abdul Aziz Yahya, consultant obstetrics and gynecologist from Prince Court Medical Centre as well as Gleneagles Medical Centre.
Welcome to the studio.
Thank you.
Thanks for joining us.
Wow, I've been doing some research online early on, and I see there's a lot of gynecological.
It's a mouthful.
All right, cancer. And I see that there's the neck of the womb or cervical cancer, ovary, womb, the uterine cancer. Is that right? Yeah. The endometrial cancer, external genitals, vulval cancer, birth canal, vaginal cancer. Wow.
Yeah.
So there's like a whole list of it. So maybe you can just give us a brief on, when we talk about, or rather when you see patients, gynecological cancer, what is the more prevalent one in Malaysia?
Well, I think very nice to be here again.
Our pleasure to have you, doctor.
The commonest female cancer or gynecological cancer, of course, if I were to say female cancer, cancer among females, right? Of course, number one is still breast. But then I'm not a breast surgeon, I'm a gynecologist.
Okay.
So I deal with the private or reproductive organs of females. And the commonest cancer in that specific system is the cervical cancer. And that's the commonest. And it's a pity as well because it's one of the easiest cancer to detect even before it becomes cancerous. And that's why I say whenever we see a patient with established cervical cancer, we always say that it's a failure of the system.
Right.
From every aspect of the system, it failed completely because she's not supposed to get it.
Exactly.
Because it's a cancer that can be prevented even before it becomes cancerous. So I will explain to you later if we have time how we do that. Because in this country, among all the gynecological cancer, cervical cancer is still the commonest. The next one is actually what you mentioned is called uterine cancer or uterine cancer or cancer of the uterus. Right. And that's cancer of the womb, sometimes people call it. It's more common among women who are who have reached menopause. And it is so easy to detect. Now, if your mom or your grandmother who are obviously menopause complain to you that she has some spotting, vaginal spotting or vaginal bleeding, which she shouldn't have, and she had it 10 or 15 years ago, and that's a symptom that should bring her to see a doctor. Because there's another cancer that we can detect early because the woman will complain of an unusual bleeding, which she shouldn't have. And when they come to see us, we obviously do a thorough examination, which include a biopsy, of course.
Okay.
And that's how we confirm cancer. You know, we sort of suspect it from asking you direct questions
Yeah.
and from your symptoms, but confirmation of cancer is always by a biopsy. Yeah?
Okay.
Yeah.
All right. So when we talk about any of these, you know, various forms that we have for women, are there any preventive measures for each of it?
Well, yes, you can. Some of them. You can't prevent all cancer. As you know, some cancers, it's just your bad luck, isn't it? You got out one morning, came to work, and you got knocked down by a car. Something similar. But there are some cancers that you can actually prevent. And the first thing that comes to my mind is cervical cancer, of course. And I'm sure you're fully aware by now that we have vaccines against this cancer.
Yes, that's right.
And this particular cancer of the cervix is caused by a virus called the human papillomavirus.
Yeah.
And there are almost more than thousands of them, but only a few, if you get it, may be oncogenic or can cause cancer. And we can detect them these days by various tests. But something you can't prevent from getting them, you know, because it comes through intercourse. I mean, sexual intercourse. You don't get this sort of virus by just sitting on the toilet bowl or by sneezing or sharing our underwear or whatever.
Yes.
But you do get through contact, sexual contacts. And therefore, these days, and I think Malaysian government has taken a headway in this by introducing vaccination among schoolgirls, aged 12 and 13, as you know, have been going on for about 4 years now, I think.
Yes.
And these vaccines are specifically designed against the virus to prepare your body to fight against the virus when it comes.
The
So
HPV.
that one way you can prevent it.
Yeah.
That is the primary prevention, the first way to prevent it by getting yourself vaccinated. So you have daughters, sisters who are around that age, you can. But this vaccination can be given up to the age of 45,
Right.
not only for schoolgirls, yeah?
Okay.
Because when the vaccine became available, it wasn't available during your time when you're in school. But you can still go and get it now, unless you're above 45.
Right.
In certain countries, they give to boys as well. In Australia and in Britain, they vaccinate boys as well because the virus comes from the boys.
Right.
The boys give it to the girls.
Yeah. But we don't do that here, do we?
Well, yeah, that's what money
I
is.
don't think
I
so.
money is an issue. So
Yeah.
it costs money.
It costs
to
money.
vaccinate
But
boys.
not in schools. It doesn't. They don't even do it in
No,
schools
in
either.
school, I think they give to girls. Yeah.
Yeah.
So in an area where you really want to prevent this, because you're not only preventing cervical cancer,
Yeah.
you're also preventing penile cancer among men.
Right.
So,
So we won't go into that.
So would it be the right thing for me to go and get an HPV shot?
Not a bad idea at all.
Not a bad idea.
You can call me after this, we can give it to you.
All right. Okay.
All right. Now, just to quickly give a shout out to our viewers out there, 2282-8578, 2282-8579. Give us a call if you would like to speak to the doctor or have a question for the doctor. Let's talk about the causes of this. Pap smears. These are something that women are always told to go and do at least once a year once they get sexually active. For younger children, is there a need for that? And if so, what age would you recommend that?
Well, it is all again is intruding into your private life, really.
Yeah.
You know, I always say that pap smear should be done the minute you become sexually active,
Okay.
regardless whatever circumstances. Yeah. These days, we always say that our girls start having intercourse,
Yep.
in
They're getting younger and
university,
younger.
but
That's
yeah,
right.
we all know. But from your reading in newspaper, they're getting younger and younger. I
Which
don't
is
have
a
to go
scary
into
thought, yeah.
yeah, I won't
Okay.
have to go into the details.
All right.
But essentially, the minute they have intercourse, I think they should be having pap smear. But then if you start having your first intercourse at the age of 15, I don't think you should be running to see a gynecologist
Of course.
because your mom will be wondering why.
Exactly.
So most of the time, the first pap smear, most people do it when they're sexually active by the time they're age 20 or 20 plus.
Okay.
And once you start doing it, perhaps you should do once a year.
Right.
Now, I told you just now about the vaccine.
Yes.
That is a primary prevention, meaning you prevent it from the virus. Yeah. But the secondary prevention is pap smear.
Right.
So this is where we're encouraging people to do. If you pass the vaccine, you go for pap smear, and you should be doing it once a year. But as doctors, we rate your risk. There are certain people who are more likely to get this cancer compared to others. Who are these people? So we profile you. Not a bad thing to profile sometimes, but we need to. If you're a smoker, I'm talking about cigarettes.
Yes.
This shisha thing that's coming in quite hot these days. I'm not referring to that.
Yeah.
Yeah. I'm referring to cigarette smoking. Now, if you're ever thinking of embarking on cigar smoking as well, maybe you should stop because cigars obviously give you more smokes.
Okay.
So any kind of smoking. Then if you have multiple sexual partners, Now, who know this? Only you know.
Right.
Whether you have, the more partners you have, the more likely for you to get the virus.
Okay. All right. Doctor, hold on to the thought of getting into our next question, because we've got a caller online right now.
Linda of Miri, Sarawak.
Hi, good afternoon. Hello, Linda. Oh, we lost you.
Oh, no.
Give us a call back, please. Linda, all the way from Miri, Sarawak. We'd love to hear what question you have for us. Give us a call back, 2282-8578, 2282-8579. All right. So we're still on the topic of gynecological cancer, and if any of you would like to have a question thrown to the doctor, give us a call, or you can just shoot into a question into our Facebook. We'll definitely pick it up as if time permits.
Now if we have a person who's concerned about cancer and they would like to get in touch with a special. Oh, we have a caller?
We have a caller.
Okay, we'll hold that.
Yeah.
Yeah. Okay. Harley from Perak. Good afternoon.
Hi, Harry.
Good afternoon.
Yes.
Yes. Actually, I would like to ask doctor pertaining to the cancer cervical as well as the uterine cancer. I would like to get clarification from the doctor. What is the factor of the cancer uterine or even the cancer cervical? Perhaps it can be caused by the hereditary factor or other factor, lack of exercise, smoking, drinking alcohol, etc. Perhaps the doctor would clarify me further about it. Thank you very much.
Okay, thanks, Harry. Thank you.
Okay, doctor, do we inherit this type of cancer?
Not these two particular cancer, unfortunately. You may inherit bowel or breast cancer, but for cervical and uterine cancer, extremely unlikely, and it's not been known to be so.
Okay.
But it's more of a biological profile of yourself, the way you live your lifestyle. And we did mention, and the guy who called just now also alluded to cigarette smoking. We do know that's a cause, and I mentioned to you just now
Of course.
about two common causes like smoking and multiple partners and multiparity, meaning too many pregnancies.
Yeah.
So too many pregnancies also is bad, too little also is equally bad.
Yes.
So it's a balance. Life is all about balance.
Yes, of course.
So I hope I can answer that question just now, but if you listen to what I said earlier on, those are some of the factors, but it is certainly not hereditary.
Right.
Don't
Okay.
blame your parents for this. Yeah.
Okay, that's nothing to do with that's nothing to do with the parents, as the doctor mentioned. All right, now, doctor, for those out there who may be going through the process of actually discovering they have any one of these kind of cancers, and especially for mothers or women who are aged above a particular age, what's your advice to them?
I want to drive this point home.
Right.
Cancer is curable.
Okay.
And I think that's the issue we are grappling with currently.
Okay, doctor, hold on a minute. Do we have a caller? Yes, we do. Hi, Josephine. Good afternoon.
Hello.
Yes.
Yeah, I would like to ask, I'm from Ipoh. Yeah, let's say you're talking about the pap smear. Let's say, for example, if the person has stopped having sexual activities for maybe around 10 years or 15 years, do she need to go for a pap smear?
Okay.
Let's say she has reached the age of the retirement age, above 50.
Okay.
And not sexually active?
Yes.
Okay. All right. So do you still need to go for pap smear?
Yeah.
All right. Thanks a lot, Josephine. We'll just put that to the doctor.
So, no loving for the past 10 years, and do we need a pap smear?
I don't know whether I should feel sorry for her.
She's probably speaking about someone else.
Yeah.
Okay, yeah. By the way, that's someone else.
Yeah.
That should be sorry for. Essentially, we encourage women to do pap smear until the age of 65. After that, because pap smear is used to detect cervical cancer.
Right.
Now, doesn't mean you stop doing pap smear at age 65. You should stop seeing your gynecologist.
Right.
The gynecologist would still have to see you
Yes.
for other checks. Because I mentioned to you just now, there are many types of cancer in the female reproductive system.
Sure.
So after the age of 65, perhaps she's not likely to develop cervical cancer, but she may develop other cancers. For example, cancer of the vulva, cancer of the vagina, etc., etc.
Or ovarian cancer itself.
Examination
Yeah.
is still essential. The doctor may omit doing a pap smear, but he or she shouldn't omit examining the lady.
Okay.
So to answer Josephine just now, yes, you continue to do pap smear until you're 65, but nothing to do with your retirement age. Some of us don't retire.
And of course, if you're still active after 65, hey, good on you, and keep doing the pap smear.
Now, even though I mentioned, it was mentioned just now, not sexually active for 10 years, but you were active before.
Yeah.
If you were to catch the virus still there. So it's essential to continue
still
to do pap
continue
smear.
on.
I mentioned earlier on about profiling people.
Yeah.
Now, if you're high risk, I encourage you to do once a year. If you're low risk, the doctor say you're low risk. You can come and see me once in 2 or 3 years.
Okay,
Yeah.
all right. So that's an option for women, isn't
course,
it? Once
yeah.
in 2 or 3 years, if they don't do it every year. What about men? So since we were talking about HPV for men, do men have to come and do not pap smears, but checkups with the gynae? Is that something that's regular?
Do men have gynaes as well?
Well, I mean, I have men in my waiting area all the time. But
Okay.
they come with their wives who come for checkups.
Okay.
But they do inquire sometimes from us.
I mean, you go see a urologist, I suppose, if you don't have any problem.
Yes, but sometimes they're more sort of feel relaxed with the gynecologist.
Right.
Because they know we're not going to examine them.
Right.
So, but we just talk to them.
But it's good to see them, yeah?
Yeah,
Yeah.
good. But I'll usually have a chat with you if
All
you
right.
have a problem. And I direct you to see whom you should see.
All right, there you go. So for women out there, the best advice the doctor has given is make sure you still go and see the doctor, even right up to the age of 65. It doesn't matter whether you're sexually active, you're not active, because you have been active. So that's another point that you need to remember. Please do make sure you do your regular checkups every year. Pap smears recommended.
All right. Well, I guess we've come to the end of this discussion.
That we
It's
have.
been a pleasure, Dr. Abdul Aziz.
Thank you, Datuk.
for
Thank you
joining
so
us.
much for joining us. All right, now we are moving on to other topics of the day. Stay with us. Don't go away. Quiz question is still there. We'll repeat it in a bit.